Essa is our sign language interpreter. Good evening, I'm Abu Bakr Abdullahi. Welcome to the broadcast. Now, the Ministry of Health, in partnership with UNICEF, is set to launch a polio vaccination campaign targeted at 13 high-risk counties in the northern part of the country. The Director General of Public Health, Dr. Francis Kuria, says the campaign has been necessitated by a surveillance conducted by the Ministry of Health in Garissa and Mombasa counties that picked a total of 6 polio cases, 3 of which were found in healthy children, reported to have been originating from the neighboring country of Somalia. Our health reporter Zainab Mohammed begins our broadcast tonight.
Even though the Africa region was declared polio-free in August last year, polio outbreaks have continuously been reported in 21 countries within the region, including Kenya. The Ministry of Health now reporting a total of 6 cases in the northern parts of the country, including Dadaab refugee camp and Garissa township, both in Garissa County, and Vita area in Mombasa County. According to the ministry, 3 out of the 6 cases that were picked in a routine surveillance were found in healthy children, reported to have been originating from Somalia.
We have detected cases in 3 children, 3 healthy children who came from Somalia. Those are stool samples taken from the children. And then we also picked 3 cases from sewage samples, one in Mombasa, a site in Mombasa and a site in Garissa.
The ministry says this has necessitated the launch of a polio vaccination campaign targeting a total of 3.4 million children below the age of 5 in 13 high-risk counties. The campaign that is set to begin on Saturday in Garissa County will be conducted in 2 phases between the 22nd and 26th of May and the 22nd and 29th of June.
As a result of the outbreak in Garissa and Mombasa counties, the Ministry of Health undertook a risk assessment and identified 13 counties as being at the highest risk and opted for emergency polio vaccination in targeted regions. Those 13 counties include Mandera, Isiolo, Wajir, Garissa, Lamu, Tana River, Kilifi, Mombasa, Kitui, Machakos, Kajiado, Kiambu, and Nairobi.
The ministry demystifying any fears towards the vaccine ahead of the launch, with assurance that the vaccines that have been in use for over 15 years have been certified as safe for use among children.
Just taking that child, open the mouth, let that drop go in, and that dream is made alive again. That child can claim Mount Kenya in future. So let us not dim the dreams of our children, and especially in those countries where we have marked in a map there. We urge you, almost persuading you, do not dim those dreams.
I was among the first people who went for the vaccine because this time round I had the choice with COVID-19 vaccine. Many years ago I didn't have that chance because somebody else had to make the decision. Today, please, let's make the decision for our children that no child can be left to the dangers of polio.
Kenya's case success in the eradication of polio continues to be undermined by a number of challenges, including neighboring countries with regular polio outbreaks and extremely low polio immunization rates among children under the age of 5, as the COVID-19 pandemic also puts a notable dent to the polio eradication campaign, with an average of 300,000 children remaining unvaccinated in the country every year. Zainab Mohammed, TV47.